Are you ready to wean your baby off breastfeeding? In this video, I'm going to show you how to stop breastfeeding cold turkey and make the transition as smooth as possible for both you and your little one. 1. What is the best way to wean my baby off breastfeeding? The best way to wean your baby off of breastfeeding depends largely on the age and individual needs of your child. If you are planning to wean an infant or toddler, it is usually recommended that you do so gradually by reducing the number of feedings per day over a period of several weeks or months. This can help ease the transition for both you and your baby, as well as reduce any emotional stress associated with ending breastfeeding. For older babies who are already accustomed to eating solid foods, transitioning away from breastfeeding may be easier. In this case, it's still important to take things slowly and create a supportive environment. Strategies like setting limits on feedings and offering distractions during times when the baby would normally nurse do. How do I stop breastfeeding cold turkey? Stopping breastfeeding cold turkey requires commitment and determination. Some women find it easier to wean gradually, but if you're ready for a more abrupt shift, here are the steps you should take. 1. Make sure that your baby is getting enough nutrition from other sources. If your baby is younger than 6 months old, it's important to ensure that he/she has access to alternative foods such as formula or solid foods. 2. Communicate with your baby that the breastfeeding routine is changing and their need for breast milk will be met in different ways now. This can help them adjust better emotionally and mentally during the transition period. 3. Cut down on nursing sessions gradually. Do this by skipping the morning session, then going to every other day, and eventually down to once a week. This gives your body time to adjust to the decrease in milk production. 4. Stay hydrated and healthy by eating nutritious meals that support your health and breastfeeding needs. 5. Consider taking natural supplements such as fenugreek or blessed thistle, which are known to help reduce breast milk supply. 6. Avoid any activities that can stimulate milk production, such as pumping or massaging breasts during the weaning process. 7. If you experience some discomfort due to engorged breasts, apply cold packs for relief or try expressing a small amount of milk until it has subsided. 3. What tips can help make the transition smoother for both baby and mom? The transition from breastfeeding to bottle feeding can be a difficult one. It's important for both mom and baby to take it slow and make the process as comfortable as possible. Here are some tips that can help make the transition smoother. Start by introducing a bottle of express breast milk rather than formula. This will give your baby time to get used to the new way of eating, while still getting all the nutrients they need from familiar milk. If you plan on weaning gradually, start by cutting down nursing sessions one at a time until your baby is completely off breastfeeding. If you choose cold turkey, do it over several days instead of abruptly stopping in one day. To reduce the discomfort for mom, try using a cold compress or an over-the-counter pain reliever to relieve engorgement and discomfort. Encourage your baby to drink from the bottle by helping them hold it in their hands and guiding them with gentle encouragement. Be patient with both yourself and your baby during the transition process. It may take some time before they feel comfortable taking milk from a bottle rather than breastfeeding, but eventually, they'll adjust. 4. Are there any necessary supplies that should be gathered ahead of time? When you're ready to stop breastfeeding cold turkey, it's important that you have the necessary supplies on hand. This might include formula, bottles, nipples, and anything else you need to feed your baby properly. You should also prepare any ointments or medications if your baby experiences discomfort due to the sudden change in diet. Additionally, if you plan to pump milk for future use, ensure that all of the necessary pumping parts are clean and functioning correctly before your last feeding session. Finally, make sure that you have plenty of supportive friends and family members available who can lend a helping hand while your body adjusts to no longer producing breast milk. Having extra help is always helpful during this transition period. 5. What are some potential signs of distress in babies during the weaning process? When babies are going through the weaning process, it is normal for them to experience some signs of distress. It is important to be aware of these signs in order to provide comfort and reassurance during this transition. Some potential signs of distress during the weaning process include irritability, lack of appetite, restlessness, difficulty sleeping, and crying or screaming more than usual. If your baby experiences any of these signs for an extended period of time, or seems overly distressed throughout the weaning process, it may be helpful to consult with the doctor for advice on how best to proceed with the process. Additionally, if you feel that you need additional support during this transition, there are many resources available, such as lactation consultants, who can help make the process smoother for both you and your baby. 6. Is it normal to still feel emotional after stopping breastfeeding entirely? Absolutely. Whatever emotions you may be feeling, it is completely normal and part of the process of weaning. It's important to remember that these feelings are valid and should not be ignored. If your emotions become overwhelming or unmanageable, reach out to a qualified mental health professional for help in navigating this transition. Additionally, if you're struggling with feelings of guilt or regret, take some time to celebrate the amazing journey you shared with your baby while breastfeeding. It was a special experience. Lastly, seek out support from family members or friends who can lend an ear and provide guidance as you go through this difficult process. With their help, combined with self-care techniques such as journaling and mindful meditation, you should be able to overcome these emotions and continue to move forward. 7. Are there any benefits associated with cold turkey weaning versus gradual weaning over a period of weeks or months? Many mothers wonder if cold turkey weaning is healthier than slow and gradual weaning. While the answer to this question will depend on each individual mother's situation, there are some benefits associated with opting for a cold turkey approach. Going cold turkey can make the process of weaning less emotionally and physically distressing for both mother and baby. Since breast milk production decreases more quickly when breastfeeding abruptly stops, it reduces the amount of time that a mother experiences engorgement or discomfort associated with full breast. It can also be easier to maintain firm boundaries around not nursing during times of temptation when going through a sudden stop versus trying to slowly decrease feedings over an extended period of time. Finally, since it takes less time overall, mothers can achieve their goals of weaning faster and more efficiently. We hope this video has been helpful in giving you a better understanding of how to wean from breastfeeding cold turkey. If done properly, this method can be an effective way for both mother and baby to transition away from nursing. We would love to hear about your experiences with the process or any advice that you have. Please leave us a comment below, and don't forget to subscribe if you enjoyed our content. Thanks for watching.